AMCA EKG technician questions, 185 questions with explained answers. Question 1. Which of the following would be filled second? Option A, Tommy Turner. Option B, Thomas Turner. Option C, Tom A. Turner. Option D, Tommy Turner. The correct answer is option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 2. Cellular respiration is a function of the option A, cell membrane, option B, mitochondria, option C, Golgi apparatus, option D, nucleus. The correct answer is option B, mitochondria. Explanation. Mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 3. Which mode of infection transmission occurs from touching contaminated linens? Option A, droplet contact. Option B, direct contact. Option C, vehicle contact. Option D, indirect contact. The correct answer is option D, indirect contact. Explanation. Contaminated linens act as an intermediate object, so transmission from touching them is classified as indirect contact rather than direct person-to-person contact. Question 4. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 5. The ability to identify with someone else's feelings is called option A, respect. Option B, feedback. Option C, sympathy. Option D, empathy. The correct answer is option D, empathy. Explanation. Empathy is the ability to understand and identify with another person's feelings while maintaining an appropriate professional perspective. Question 6. A monitor that a patient wears for 24 hours is called an option A, Holter. Option B, 12 lead. Option C, Holter. Option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 7. The layer of the heart that is responsible for contraction and relaxation is known as the option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 8. The main purpose of personal protective equipment is to option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 9. Name this part of the electrocardiogram. Option A, R-to-R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 10. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles. Option B, lab coat. Option C, gloves. Option D, mask. The correct answer is option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 11. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A. The medical assistant can use capillary tubes for the blood collection. Option B. Draw a red top tube before the light blue tube. Option C. Fill a light blue to the top. Option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 12. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 13. The patient complains that it hurts when they swallow. This type of complaint is considered. Option A, assessment. Option B, plan. Option C, objective. Option D, subjective. The correct answer is option D, subjective. Explanation. Pain with swallowing is a symptom reported by the patient, so it is subjective information rather than an objective finding directly measured by the examiner. Question 14. Which chest lead is placed on the right sternal border in the fourth intercostal space? Option A, V3. Option B, V1. Option C, V2. Option D, V4. The correct answer is option B, V1. Explanation. Chest lead V1 is placed at the fourth intercostal space along the right sternal border. Question 15. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 16. Hypotension is defined as: Option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 17. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 18. To indicate that something lies nearer the surface, use the term. Option A, distal. Option B, deep. Option C, superficial. Option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 19. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 20. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 21. Which of the following is known as swimmer's ear? Option A, otitis externa. Option B, otitis. Option C, otitis media. Option D, otitis interna. The correct answer is option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 22. The patient information sheet contains: Option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 23. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A, 148/96. Option B, 116/72. Option C, 126/84. Option D, 178/104. The correct answer is option A, 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 24. The amount of blood pumped by the heart per minute is called: Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation. Cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 25. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 26. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A, atrioventricular node. Option B, bundle branches. Option C, ventricle. Option D, sinus node. The correct answer is option A, atrioventricular node. Explanation. A junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 27. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 28. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, CHAMP Aid. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 29. Notifiable infection must be reported to: Option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 30. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is option C, consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 31. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 32. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 33. Which of the following is an example of proxemics? Option A, eye contact. Option B, facial expression. Option C, personal contact. Option D, personal hygiene. The correct answer is option B, facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 34. One example of a physiologic response to negative stress is: Option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 35. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 36. The best way to handle a difficult or bad patient is to: Option A, threaten to report the patient to his or her doctor. Option B, speak firmly to maintain charge of the situation. Option C, help the patient to feel in control of the situation. Option D, leave the room without collecting the specimen. The correct answer is option C, help the patient to feel in control of the situation. Explanation. Helping an upset patient feel some control can reduce confrontation and improve cooperation while the medical assistant maintains clear professional boundaries and safety. Question 37. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 38. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 39. Normal sinus rhythm has a heart rate of beats per minute. Option A, 80 to 120. Option B, 50 to 75. Option C, 60 to 100. Option D, 40 to 60. The correct answer is option C, 60 to 100. Explanation. Normal sinus rhythm is commonly defined as a regular sinus rhythm with a rate from 60 to 100 beats per minute in an adult. Question 40. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation. The kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 41. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 42. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing: Option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow Q or S complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 43. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 44. A tympanic temperature means the body temperature is measured. Option A, under the armpit. Option B, under the tongue. Option C, at the eardrum. Option D, in the rectum. The correct answer is option C, at the eardrum. Explanation. Tympanic temperature is measured at the ear canal near the tympanic membrane, also called the eardrum. Question 45. The principal advantage of using wave method when designing the scheduling process is that it, option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 46. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 47. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 48. Another term for outpatient care is option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 49. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 50. The patient's chart indicates a urine sample was collected at 1,800. This means the sample was collected at option A, 8 inches the morning. Option B, 8 inches the evening. Option C, 6 inches the morning. Option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1,800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 51. Which of the following statements is true under the doctrine of respondeat superior? Option A. The physician is responsible for any errors made by the medical staff. Option B. The person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C. The medical administrative assistant is responsible for any errors made by the medical staff. Option D. The medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 52. Most exposures to human immunodeficiency virus in healthcare settings are the result of option A. Contact with acquired immunodeficiency syndrome patients. Option B. Splashes during surgery. Option C. Accidental needle sticks. Option D. Tainted blood transfusions. The correct answer is option C. Accidental needle sticks. Explanation. Needle stick injuries are a major occupational route of exposure to bloodborne pathogens because contaminated sharps can introduce infected blood directly through the skin. Question 53. The patient's specimen is lipemic. This is usually an indicator that the patient is: Option A, smoking. Option B, not fasting. Option C, normal. Option D, in basal state. The correct answer is option B, not fasting. Explanation. Lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 54. Choose the answer that corresponds with letter A. Option A, cephalic vein. Option B, radial artery. Option C, ulnar artery. Option D, brachial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 55. Insulin syringes are calibrated in: Option A, milliliters. Option B, units. Option C, cubic centimeters. Option D, minims. The correct answer is option B, units. Explanation. Insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 56. A patient has an oral temperature of 100.8 degrees Fahrenheit. The medical term for this is: Option A, pyrexia. Option B, pyuria. Option C, hyperpyrexia. Option D, purulent. The correct answer is option A, pyrexia. Explanation. Pyrexia means fever, so an oral temperature above the normal range may be described as pyrexia. Question 57. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation. The autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 58. A normal resting heart rate for the average adult is: Option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 59. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 60. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 61. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 62. Two employees discussing a patient diagnosis on a hospital elevator with other people present is a violation of: Option A, patient rights. Option B, patient privacy. Option C, patient confidentiality. Option D, patient insurance. The correct answer is option C, patient confidentiality. Explanation. Discussing a patient's diagnosis where unauthorized people can hear it exposes confidential health information and violates the duty to protect patient confidentiality. Question 63. A murmur is an abnormal sound that may indicate: Option A, intestinal obstruction. Option B, valvular heart disease. Option C, stroke. Option D, bronchial asthma. The correct answer is option B, valvular heart disease. Explanation. A heart murmur is an extra or unusual sound caused by turbulent blood flow and may be associated with abnormal heart valves. Question 64. What is the best location to check the pulse of an adult who is unconscious and not breathing? Option A, at the carotid artery of the neck. Option B, on the chest, directly over the heart. Option C, at the radial artery of the wrist. Option D, at the brachial artery of the arm. The correct answer is option A, at the carotid artery of the neck. Explanation. The carotid artery is a central pulse site that is commonly checked in an unresponsive adult because it can remain palpable when peripheral pulses are weak. Question 65. Asystole. Option A, is defined as the presence of chaotic cardiac activity. Option B, produces a complete cessation of cardiac output. Option C, is the most common primary event in cardiac arrest in the adult. Option D, appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Asystole means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 66. When a patient fails to show for their appointment, the event must be: Option A, erased from the schedule. Option B, written on a no-show log. Option C, monetarily charged to the patient. Option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 67. Tachycardia is a pathology that damages mainly the: Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source key's heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 68. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 69. A pounding or racing of the heart, such that the patient is aware of his and her heartbeat, is called an. Option A, palpitation. Option B, ectopic beat. Option C, hemoptysis. Option D, arrhythmia. The correct answer is option A, palpitation. Explanation. A palpitation is the sensation of being aware of a forceful, rapid, irregular, or pounding heartbeat. Question 70. The method of scheduling in which one patient is scheduled for a specific appointment time is known as: Option A, single booking. Option B, standard scheduling. Option C, cluster scheduling. Option D, fixed appointment scheduling. The correct answer is option A, single booking. Explanation. Single booking schedules one patient for one specific appointment time, giving each patient an individual time slot. Question 71. When medical assistants are able to adapt to various situations, they are considered to be: Option A, courteous. Option B, flexible. Option C, dependable. Option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 72. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 73. Issues relating to medical advances come under the heading of option A, malfeasance, option B, religious freedom, option C, bioethics, option D, ethics. The correct answer is option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 74. When the body has had adequate rest and no food for at least 12 hours, it is said to be in option A, hemostasis, option B, basal state, option C, homeostasis, option D, steady state. The correct answer is option B, basal state. Explanation. Basal state describes the body after adequate rest and fasting, when metabolic activity is measured under relatively standardized resting conditions. Question 75. A provider withdraws from the care of a patient without reasonable notice of discharge is considered option A, abandonment, option B, malpractice, option C, negligence, option D, slander. The correct answer is option A, abandonment. Explanation. Abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 76. One mental health illness that can hinder patient education is option A, chicken pox, option B, high blood pressure, option C, Alzheimer's disease, option D, depression. The correct answer is option C, Alzheimer's disease. Explanation. Alzheimer's disease can impair memory, attention, comprehension, and learning, which can make patient education more difficult and may require adapted teaching methods. Question 77. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance, option B, human resources, option C, accounts payable, option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 78. Two premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce, option B, couplet, option C, bijgmini, option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 79. A 45-year-old man comes in for a stress test. His resting blood pressure is 120/80. During the stress test, his blood pressure dropped to 95/55 and his skin is cold and clammy. What is the best course of action? Option A, stop for a minute, then resume. Option B, stop the test immediately. Option C, slow the test and then pick the pace back up. Option D, push forward with the test. The correct answer is option B, stop the test immediately. Explanation. A major blood pressure drop with cold, clammy skin during a stress test suggests poor tolerance and possible circulatory compromise, so the test should be stopped immediately for patient safety. Question 80. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection? Option A, portal of exit. Option B, susceptible host. Option C, infectious agent. Option D, mode of transmission. The correct answer is option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 81. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation. Sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 82. Thixotropic gel, found in the serum separator tube red-gray marbled-topped vacutainer tube. Option A, is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. Option D, has the same density as red blood cells. The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 83. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 84. A quantitative test is one that: Option A, tests for the presence and amount of substance in sample. Option B, tests for presence of substance only. Option C, does not require a trained technician. Option D, tests for all substances found in the sample. The correct answer is option A, tests for the presence and amount of substance in sample. Explanation. A quantitative test reports how much of a substance is present, while a qualitative test generally reports whether the substance is present or absent. Question 85. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called: Option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation. Auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 86. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation. Heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 87. When analysis of a patient flow is reviewed, what does this help a practice determine? Option A, the day of the week that most patients come in. Option B, the number of times per year a patient visits the medical office. Option C, the amount of time the provider sees patients per week. Option D, the realistic time frame for each appointment. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 88. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medican cubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 89. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 90. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcyon. The correct answer is option B, warfarin Coumadin. Explanation. Warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 91. During assessment, the best source from which to obtain patient information is the: Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 92. When a person stays in the same position all the time, pressure causes the skin to: Option A, become firm and dry. Option B, weaken and become necrotic. Option C, become stronger. Option D, stay pink and moist. The correct answer is option B, weaken and become necrotic. Explanation. Prolonged pressure reduces blood flow to compressed tissue, which can cause tissue injury, breakdown, and eventually necrosis. Question 93. The correct lead from the center of heart to the positive pole of the leg is: Option A, augmented voltage foot lead. Option B, augmented voltage right arm lead. Option C, lead 3. Option D, lead 2. The correct answer is option A, augmented voltage foot lead. Explanation. The augmented voltage foot lead views electrical activity toward the positive electrode on the left leg from a calculated central reference point. Question 94. A structure that is composed of two or more tissue types is called a and an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of two or more tissue types that work together to perform specific functions. Question 95. Family members, such as spouse or children that are covered under the member's insurance policy are known as: Option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 96. Identify the rhythm that will often produce an irregular rhythm. Option A, atrial tachycardia. Option B, sinus dysrhythmia. Option C, ventricular tachycardia. Option D, sinus bradycardia. The correct answer is option B, sinus dysrhythmia. Explanation. Sinus dysrhythmia produces a rhythm that varies with the respiratory cycle, so the intervals between beats can appear irregular while the impulses still originate in the sinus node. Question 97. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 98. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 99. Which of the following is not true regarding Health Insurance Portability and Accountability Act laws? Option A. Patients can make informed choices regarding how their personal health information is used. Option B. Few boundaries are set on the use and release of health records. Option C. Patients have more control over their medical records. Option D. Violators are held accountable if patient privacy rights are compromised. The correct answer is option B. Few boundaries are set on the use and release of health records. Explanation. The statement that few boundaries exist is false because the Health Insurance Portability and Accountability Act privacy rule places important limits on how protected health information may be used and disclosed. Question 100. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 101. The interval between exposure to infection and the appearance of the first symptom is called: Option A, incubation period. Option B, active period. Option C, means of transmission period. Option D, incineration period. The correct answer is option A, incubation period. Explanation. The incubation period is the time between exposure to an infectious agent and the appearance of the first signs or symptoms of disease. Question 102. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 103. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 104. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation. The first Kurokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 105. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 106. You performing a venipuncture procedure on a patient. The needle appears to be inside the vein yet no blood ID flowing into the tube. What should you do? Option A, pull back on the needle. Option B, terminate the procedure. Option C, slightly rotate the needle. Option D, switch the tubes. The correct answer is option D, switch the tubes. Explanation. If the needle appears to be in the vein but no blood enters the tube, a defective tube with lost vacuum is one possible cause, so changing the tube is an appropriate troubleshooting step. Question 107. A 67-year-old man is diagnosed with atrial fibrillation and is treated with warfarin Coumadin. What is the characteristic of atrial fibrillation? Option A, sawtooth-shaped waves. Option B, P waves are absent. Option C, P waves with uniform shape. Option D, P waves of multiple shapes. The correct answer is option B, P waves are absent. Explanation. In atrial fibrillation, organized P waves are absent because atrial electrical activity is rapid and chaotic rather than produced by regular sinus node impulses. Question 108. Which of the following is correct for ending a venipuncture procedure? Option A, remove the tourniquet, remove the needle, remove the tube, apply pressure. Option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Option C, remove the needle, remove the tube, remove the tourniquet, apply pressure. Option D, remove the tube, remove the tourniquet, remove the needle, apply pressure. The correct answer is option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Explanation. Releasing the tourniquet and removing the collection tube before withdrawing the needle reduces venous pressure and helps end the draw safely before pressure is applied. Question 109. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 110. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 111. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken, option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 112. What does the inside address in a typewritten letter need to include? Option A, the salutation. Option B, the body of the letter. Option C, the name and address of the person sending the letter. Option D, the name and address of the person receiving the letter. The correct answer is option D, the name and address of the person receiving the letter. Explanation. The inside address identifies the recipient of a business letter by giving the recipient's name and mailing address before the salutation. Question 113. The tube of choice for glucose testing is Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 114. The physician prescribes a buccal medication. The medical assistant should instruct the patient to: Option A, place the medication between the lower teeth and cheek. Option B, chew the medication and swallow it. Option C, place the medication under the tongue. Option D, dissolve the medication in water and drink it. The correct answer is option A, place the medication between the lower teeth and cheek. Explanation. A buccal medication is designed to dissolve between the cheek and gum so the drug can be absorbed through the lining of the mouth. Question 115. Which of the following procedures can be performed by a medical assistant? Option A, intramuscular injection. Option B, start fluids through a catheter. Option C, insert peripheral catheter. Option D, intravenous injection. The correct answer is option A, intramuscular injection. Explanation. Intramuscular injections are within the usual delegated clinical duties of a properly trained medical assistant when permitted by state law and office policy, while intravenous procedures may require different authorization. Question 116. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately: Option A, 5 grams per deciliter. Option B, 5%. Option C, 45%. Option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 117. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 118. The primary purpose of wearing gloves during phlebotomy procedures is to protect the: Option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 119. The correct lead from the right arm to the leg is: Option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 120. Every prescription for a controlled substance requires the physician's signature and a number. Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation. Controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 121. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 122. Choose the answer that corresponds with number E. Option A, basilic vein. Option B, radial artery. Option C, cephalic vein. Option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 123. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 124. The National Health Insurance Plan for Americans age 65 and older is: Option A, Civilian Health and Medical Program of the Department of Veterans Affairs. Option B, Medicaid. Option C, TRICARE. Option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 125. The smallest structural unit of the nervous system is the: Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 126. Which of the following is correct regarding contact transmissions? Option A, it involves the transfer of pathogens by food and water. Option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Option C, it involves transmission of pathogens that remain suspended in air for a long period of time. Option D, it refers to the transfer of pathogens by mosquitoes, flies, and rats. The correct answer is option B. It involves contaminated instruments, needles, or contaminated hands that are not washed. Explanation. Indirect contact transmission can occur when pathogens are transferred by contaminated instruments, surfaces, or hands that have not been properly cleaned. Question 127. A collection tube containing an anticoagulant must be inverted how many times? Option A, tubes containing anticoagulants are not inverted at all. Option B, 10 times. Option C, 8 times. Option D, shake vigorously for 30 seconds. The correct answer is option C, 8 times. Explanation. Anticoagulant tubes are gently inverted several times so blood mixes evenly with the additive and small clots do not form. The source specifies 8 inversions for this item. Question 128. Before developing a medication schedule, you should evaluate the patient's: Option A, bathroom habits. Option B, medical record. Option C, daily routine. Option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 129. The primary function of the nervous system is: Option A, to protect deep organs. Option B, to cleanse the blood of pathogens. Option C, to detect changes in the internal and external environment and respond appropriately. Option D, to provide body support and levers for muscle action. The correct answer is option C, to detect changes in the internal and external environment and respond appropriately. Explanation. The nervous system senses changes inside and outside the body, processes that information, and coordinates an appropriate response. Question 130. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 131. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policy holders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 132. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 133. Muscles that act on the knee joint exhibit two actions. Option A, adduction and lateral rotation. Option B, medial rotation and extension. Option C, adduction and abduction. Option D, flexion and extension. The correct answer is option D, flexion and extension. Explanation. The knee primarily moves through flexion and extension, which bend and straighten the joint. Question 134. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the Option A, standard limb lead 3. Option B, augmented lead. Option C, standard limb lead 2. Option D, standard limb lead 1. The correct answer is option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 135. Sinus is a slow dysrhythmia. Option A, bradycardia. Option B, tachycardia. Option C, rhythm. Option D, dysrhythmia. The correct answer is option A, bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 136. The Q wave, if present, is always Option A, positive. Option B, present. Option C, isoelectric. Option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 137. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 138. Another name for chest leads is Option A, standard. Option B, precordial. Option C, limb. Option D, augmented. The correct answer is option B, precordial. Explanation. Precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 139. The information of blood cells is defined as Option A, hematopoiesis. Option B, erythropoietin. Option C, mean corpuscular volume. Option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 140. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation. Red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 141. Demerol 75 mg, intramuscular every 4 hours, as needed for severe pain, is what type of medication order? Option A, single. Option B, as needed. Option C, immediate. Option D, routine. The correct answer is option B, as needed. Explanation. The phrase as needed means the medication is given only when the patient meets the stated need, so this is an as needed medication order rather than a routine or one-time order. Question 142. What position should the patient be placed in when performing an electrocardiogram? Option A, dorsal recumbent. Option B, supine. Option C, Trendelenburg. Option D, prone. The correct answer is option B, supine. Explanation. The supine position keeps the patient lying flat and relaxed, which helps reduce muscle artifact and allows consistent placement of electrocardiogram electrodes. Question 143. The three kinds of blood cells are Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation. The three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 144. Aspirin and acetaminophen are examples of Option A, analgesics and antipyretics. Option B, antitussives and decongestants. Option C, antihistamines and antiemetics. Option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 145. What is the name of the law that protects healthcare workers who gave aid during the time of an accident? Option A, Good Samaritan Law. Option B, Megan's Law. Option C, Right to Know Law. Option D, Health Insurance Portability and Accountability Act. The correct answer is option A, Good Samaritan Law. Explanation. Good Samaritan laws are intended to provide certain legal protections to people who voluntarily give emergency assistance in good faith, although the exact protections vary by jurisdiction. Question 146. Identify the following rhythm. Option A, atrial fibrillation. Option B, ventricular fibrillation. Option C, junctional tachycardia. Option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 147. What is the correct way to calculate pulse pressure? Option A, the number found when subtracting the diastolic from the systolic. Option B, the sum of the diastolic and the systolic. Option C, the pulse taken at the carotid location. Option D, the pulse taken at the apical location. The correct answer is option A, the number found when subtracting the diastolic from the systolic. Explanation. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, which shows the pressure difference between heart contraction and relaxation. Question 148. The acronym used to remember the actions to take when using a fire extinguisher is: Option A, ACT. Option B, HELP. Option C, Rescue, Alarm, Confine, and Extinguish or Evacuate. Option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. The correct answer is option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. Explanation. The fire extinguisher sequence is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side so the extinguishing agent is directed effectively. Question 149. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is option B, splashing of blood when a cap is removed. Explanation. Blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 150. Verbal facial expressions or body language, such as a nod of understanding, are called: Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is option D, feedback. Explanation. Feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 151. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 152. The four symptoms of inflammation are erythema, edema, pain, and Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 153. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 154. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 155. How many electrodes are used as part of a 12-lead electrocardiogram? Option A, 10, option B, 6, option C, 12, option D, 8. The correct answer is option A, 10. Explanation. A standard 12-lead electrocardiogram uses 10 electrodes to generate 12 electrical views of the heart. Question 156. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation. Rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 157. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called. Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 158. Telephone etiquette involves. Option A, remaining anonymous to avoid any responsibility. Option B, leaving a person on hold until you have the answer. Option C, referring an emotional caller to the administrator. Option D, keeping your statements simple and to the point. The correct answer is option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 159. All pathogens are. Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 160. A fluctuating fever that returns to or below baseline then increases again is. Option A, intermittent. Option B, remittent. Option C, onset. Option D, continuous. The correct answer is option A, intermittent. Explanation. An intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 161. Collection devices used in skin punctures are called. Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation. Capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 162. The functional unit of the kidney is the. Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 163. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 164. A blood sample is collected from a patient and the plasma is pink to red in color. Which of the following is the most likely cause? Option A, polycythemia. Option B, hemolysis. Option C, lipema. Option D, agglutination. The correct answer is option B, hemolysis. Explanation. Hemolysis releases hemoglobin from ruptured red blood cells, which can make serum or plasma appear pink to red. Question 165. Managed care organizations control costs by. Option A, limiting patient enrollment. Option B, detecting risk factors early. Option C, discouraging patient visits. Option D, eliminating case managers. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 166. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 167. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the Option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 168. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 169. If a finger is excessively milked during a skin puncture, the result will be: Option A, a decrease in pain for the patient. Option B, increased venous blood flow to the puncture site. Option C, an adequate of blood for filling several capillary tubes. Option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation. Excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 170. One method to calculate heart rate from an electrocardiogram strip is to: Option A, count the small boxes between the R to R interval and divide by 1,500. Option B, count the number of small boxes in the R to R intervals and divide by 2. Option C, estimate by counting R peaks in 10-second strip and multiply by 10. Option D, count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is option A, count the small boxes between the R to R interval and divide by 1,500. Explanation. At a paper speed of 25 mm per second, dividing 1,500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 171. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 172. Which agency regulates the Controlled Substances Act? Option A, Internal Revenue Service. Option B, Drug Enforcement Administration. Option C, Special Weapons and Tactics. Option D, Occupational Safety and Health Administration. The correct answer is option B, Drug Enforcement Administration. Explanation. The Drug Enforcement Administration enforces federal controlled substance laws and regulations, including requirements under the Controlled Substances Act. Question 173. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Explanation. The source keys the tube containing ethylenediamine tetrashic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 174. A pulse site used to measure blood pressure is: Option A, brachial. Option B, popliteal. Option C, radial. Option D, temporal. The correct answer is option A, brachial. Explanation. The brachial artery is the standard pulse site used with a blood pressure cuff because the cuff is placed around the upper arm and the artery is assessed near the elbow crease. Question 175. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 176. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 177. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 178. Defamation through spoken statements is known as option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 179. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation. Lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 180. A is a set amount that the patient may be required to pay the provider before they can receive benefits. Option A, coinsurance. Option B, deductible. Option C, copayment. Option D, fee schedule. The correct answer is option C, copayment. Explanation. A copayment is a fixed amount the patient pays for a covered service, usually at the time the service is received, according to the insurance plan. Question 181. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed. Option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 182. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 183. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation. Loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 184. Which is an example of a recommended preventive procedure? Option A, eating the recommended daily allowances. Option B, teeth whitening. Option C, childhood immunizations. Option D, daily exercise. The correct answer is option C, childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 185. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result.